Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about gout. In particular, I will cover what is gout, how you treat gout, and how you can better live with gout. So we start with what is gout. Gout is a condition that causes pain, inflammation, and swelling in one or more of the joints. It usually affects the big toe but can develop in any joint in the body. Gout tends to occur in attacks, which usually lasts for a period of between 3 to 10 days, after which the joint should feel normal and pain-free again. However, these attacks are almost impossible to predict, and if left untreated can cause future attacks to be more frequent and last for longer. An acute attack of gout can wake you up in the middle of the night feeling like your big toe is on fire. The affected joint is hot, swollen, and so tender that even the weight of a sheet on it seems intolerable. Gout affects roughly 1 in 200 people, with men being more prone than women. The primary symptom of gout is acute, sudden and severe joint pain, usually in the joint of the big toe. Symptoms will often develop during the night, although they can occur at any time. Other symptoms of gout include inflammation, red and shiny skin over the affected joint, peeling, itchy and flaky skin over the affected joint, swelling as well. The intense pain that gout causes can make walking and getting around difficult. Even the light pressure of a bed cover or blanket can be painful. Although gout is most common in the big toe, it can affect any of the joints. It can also occur in 2 or more joints at the same time. Affected joints may include heels, ankles, knees, fingers, toes, wrists and elbows. The sooner symptoms are treated, the more quickly the pain will pass. So you may experience symptoms every few weeks, months or years, but it is impossible to predict when the condition will recur. 62% of people experience a repeat attack of gout within 1 year. However, some people will only ever experience one attack in their lifetime. So the sooner symptoms are treated, the more quickly the pain will pass. So you may experience symptoms every few weeks, but it is impossible to predict when the condition will recur. Gout is caused by a buildup of uric acid or urate in your blood. Urate is normally harmless waste product which is formed when the body breaks down substances known as purines. Purines are found naturally in the body, but are also found in some foods and certain types of alcohol. Urate normally dissolves in your blood and passes through your kidneys into the urine, ready to be excreted by your body. If you produce too much urate or excrete too little, the urate builds up and can sometimes cause small, sharp crystals to form, usually in the joint or in the surrounding tissue. It is these crystals that cause the pain, swelling and inflammation associated with gout. There are some factors which can increase the level of urate in your blood, which include, for men, if you're a man, gout rarely affects women, and if you have a high purine diet. Some foods and certain types of alcohol are high in purines. And some medicines, certain types of medicine can increase your urate level. And obesity, if you are overweight, losing weight can significantly reduce your urate levels. And psoriasis. Psoriasis causes skin cells to reproduce too quickly, leading to red, flaky and crusty skin. And hypertension, persistent high blood pressure, and also diabetes, having high blood sugar levels, and also reduced kidney function, for example, after a kidney transplant or if you have kidney failure, and also hyperlipidemia, high fat and cholesterol levels in your blood, and vascular disease when your arteries become thick and narrowed or blocked. So next is, how do you treat gout? Treatment for gout usually involves medications. Different medicines are prescribed to treat acute gout attacks and prevent future attacks and long-term control of gout. Drugs used to treat acute attacks and prevent future attacks include non-steroidal anti-inflammatory drugs, or the NSAIDs, and the NSAIDs may control inflammation and pain in people with gout. The NSAIDs include over-the-counter options such as Nurofen, as well as more powerful prescription NSAIDs such as Diphene. But NSAIDs do carry risks of stomach pain, bleeding and ulcers. Next medicine would be colchicine. If you're unable to take the NSAIDs, your doctor may recommend colchicine, a type of joint reliever that effectively reduces gout pain, especially when started soon after symptoms appear. Next would be corticosteroids. The corticosteroid medications, such as the drug prednisolone, may control gout, inflammation and pain. Next is ice. One of the most immediate ways you can treat the pain is to apply ice to the affected joint. So drugs used for the long-term control of gout include the medication that blocks uric acid production. Drugs like allopurinol limit the amount of uric acid your body makes. This may lower your blood's uric acid level and reduce your risk of gout. So medication that improves uric acid removal would be probenecid, improves your kidney's ability to remove uric acid from your body. This may lower your uric acid levels and reduce your risk of gout. But the level of uric acid in your urine is increased. The side effects include a rash, stomach pain and kidney stones. And finally, how do you live with gout on a day-to-day basis? Medications are the most proven effective way to treat gout symptoms. However, making certain changes in your diet also may help. The following guidelines are recommended. Eat a moderate amount of protein, preferably from healthy sources such as low-fat or low-free dairy, tofu, eggs, and not butter. Limit your daily intake of meat, fish and poultry. Avoid alcohol or drink it in moderation. Drinking too much alcohol increases the risk of hyperuricemia because it interferes with the removal of uric acid from the body. Drink plenty of fluids. Fluids can help remove uric acid from the body. However, limit consumption of sugar-sweetened soft drinks, which have been linked to an increased risk of gout. Maintain a healthy weight. Excess weight puts more stress on your joints and increases the risk of hyperuricemia and gout. Lose weight if you're overweight, but avoid fasting or rapid weight loss diets because they can increase uric acid levels in the blood. Also avoid low carbohydrate diets that are high in protein and fat, which again can increase hyperuricemia. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing gout on a day-to-day basis more effectively. To start with, we have numerous products to get you started on an exercise program, such as exercise ball, floor mats, weights and various other items to get you up and running on a program we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as vitamins, ginseng, light box, blood pressure monitors, blood sugar monitors and body fat monitors, and also assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of our brand new offering at Telehealth Clinic. You can book a 30-minute clinic with us and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing gout with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.